Hi, my name is Aaron Shaw. I'm an occupational therapist and a certified hand therapist at MoveMend. What I want to talk about today is some ways for you to see if that elbow pain you have might be tennis elbow. Tennis elbow, which is also known as lateral epicondylitis or lateral epicondylosis, is pain that is located on the outside of the elbow, kind of around the bony area of the elbow, and that pain can be quite severe, can limit hand function, limit the ability to lift, push, pull, and use your hand for everyday activities, including sport. Although a lot of people, if not most people that have the diagnosis of tennis elbow don't actually play tennis at all. Well, one way to see if the symptoms and the aches and pains you have in your elbow might be this condition, there's a couple things you can do at home to find out. One thing you can do is if you make a really tight fist and you bend your wrist up, if you notice an increase in pain on the outside of your elbow, that may be a sign of tennis elbow. Another thing that may cause this discomfort is if you were to make a light fist and then stretch your wrist downward, putting a stretch on the back of the arm. If you notice that that causes quite a bit of pain up again on the outside of the elbow, that may also be a sign of tennis elbow. Commonly there's tenderness either just above the elbow, right on the bony point of the elbow, and then even going down through the forearm muscles. So this is a really common condition for people who do lift, push, and pull and do a lot of manual activities. Sometimes it's a problem with people who work on the computer. But what we do here at MoveMend is do a movement assessment, assess the symptoms. We do a couple of other provocative tests to make sure that if indeed you have tennis elbow or this lateral epicondylitis, that we treat it appropriately. So some of the things that we have for tools of the trade, we do some kinesio taping to provide support and decrease pain of the elbow. We sometimes use splints or straps. You may see some tennis players that actually wear these straps around their forearm. For some people that can decrease pain, decrease the symptoms. And then also for those people who actually do play tennis or golf or ride their bike, we do biomechanical assessment to make sure that their elbow pain isn't being caused from weakness in core muscles, weakness in shoulder muscles, or just faulty mechanics on how they're moving around. So if you are suffering from elbow pain on the outside of your elbow, think you might have a case of tennis elbow or epicondylitis, try these stretches, see if that increases your pain. Forceful grip with your elbow straight. If that increases your pain, give us a call. Phone number here is 206-641-7733, or if you want to schedule an appointment directly, you can do that from our website at movemend.info.